Good afternoon to all our viewers. Welcome to the Let's Talk It Over webinar. This LTIO is titled Public Health Preparedness Amidst Pandemic Nursing Experience. So I'm Rita Ramos, one of your moderators for today. And this webinar is organized by the Master of Arts in Nursing program under the Faculty of Management and Development Studies. In the field of public health nursing, nurses have been in the forefront of the communities and barangays when the pandemic started. They have been actively doing their responsibilities to the community and providing care to the people. They have been busy in the prevention and promotion of health in the communities. This webinar is an opportunity for them to share their stories and express how they feel as frontliners in the communities. Maria, good afternoon, Maria.
Good afternoon, ma'am. Yes, welcome everyone. I am Ria Cabanes, also one of the moderators. Thank you very much, speakers, for accepting our invitation. We have three public health nurses today who will talk about their experiences and challenges in their communities and barangays during this pandemic period, and how they were able to prepare, cope, and develop strategies in their own communities. We will have an open forum after all the speakers have finished their presentations. You can put your questions in the comment box sections of the UPOU Network's website and the UPOU Network Facebook page.
Okay, before we call on our speakers for today, let me share reminders about the e-certificate that LTIO shall issue to our viewers. Please take note that only those who shall participate in the online evaluation of this webinar shall be issued with certificates. Before the end of the program, we shall share the evaluation link, right, Ria, and evaluation QR code. So watch out for those later. Now let us start our webinar, Ria. May you please introduce our first speaker.
Thank you, Ma'am Rita. Our first speaker is an alumna of the UP College of Nursing. She has 2 years stint as a hospital nurse in the Philippine General Hospital, and then she opted to go into public health. For the past 35 years, she is in public health. She holds the position Nurse Program Supervisor handling maternal and child health and newborn screening programs. She is currently the officer in charge of the Division of Nursing Services of the Manila Health Department. Let's all welcome Ms. Nelia Rafael.
Okay, so good day to everyone. Um, Good day to everyone. This afternoon, I am tasked to share the Manila Health Department experience in the field of this COVID pandemic, which we are facing today. So, for a background, I hope I can do justice to all the nurses in the Manila Health Department. For a background, the city of Manila is considered a premier city. It is headed by our very energetic mayor, Yorme Isko Moreno. It has a 1.9 million population with 896 barangays, 30% of which are depressed. Okay. Because of its diversity, it has its share of complex problems. Hence, the quality of healthcare delivery system in Manila is proactive. And because of this, the 200 or so, almost 200 or so public health nurses in the city in the department are always the frontliners in delivering healthcare and basic health programs in the community, be it in the health centers, in public high schools, and in specialized services. For our experiences, okay, ano yan? Ano nangyari? Ano nangyari? Erika, what happened? Okay. Um, for our experiences, okay, the nurses are not new to disasters and emergencies. During World War II, they served as they serve as nurses in devastated areas and in concentration camps. Fast forward na tayo ngayon. In public health, an outbreak is always a challenge. The city had a measles outbreak early of 2019. This was followed by another event. The Philippines has been polio-free since 2000. for the past 20 years. But in August 2019, the WHO declared the presence of the strain of poliovirus in the sewers of Manila. This was the start of a grueling 5-month door-to-door campaign, door-to-door immunization for poliomyelitis. Okay. So this was to start in August and then to end in March of 2020, the following year. In March 8th, 2020, that would have been the last day of the polio campaign. Okay? But the nurses, they were looking forward to a respite, vacation leaves, stress management, facials, and spas. But after a grueling 5 months, came uh, the event that would intervene. Before that, a series of meetings were held with the DOH. This was conducted because the emergence of the coronavirus. Surveillance nurses then were already going on duty to the newly created Manila Emergency Operations Center. On March 16, 8 days after the polio immunization campaign, Metro Manila was declared as an ECQ area. Okay, so um, what were the challenges that the nurses had to undergo? First, there was disruption. Of course, everybody, the nurses were not spared from this. Everybody, there was a suddenness and shift from their daily routine. Everybody was taken out of their comfort zone. The second one was fear and ambivalence, fear of the unknown. Nurses are used to contact tracing, they are used to epidemiological investigations, be it measles, diphtheria, polio, meningococcemia, and the like. They know the mode of transmission, they know the management, prevention, and control. But with COVID, it was a different story altogether. Uh, we know it was droplet infection, but the spread of infection was so fast and people in the various countries were dying. There was no cure and there was no vaccine. So, it is understandable that for us frontliners, fear and ambivalence were felt at that time. So with this, there was multitasking. Okay, multitasking. Why multitasking? Nurses were at once assigned in COVID hospitals, quarantine facilities. Putting up a quarantine facility is no big deal. Different disciplines from different areas would would unite to put up an efficient quarantine facility. We see tents, we see triage areas just in the movies. But with this, they were instructed to do to convert schools into quarantine facilities. Okay, um, the task that they used to do would be very very different from there on. So in the hospital, they were assigned in triage areas, emergency rooms, and then in the COVID wards. So, okay. And then in the quarantine facility, they took on another role, which would be lead nurse, rotator nurse. Just like in the hospitals, merong charge nurse or staff nurse. Okay. And they would be doing surveillance. There would be the surveillance officers, contact tracers, data managers and encoders, rapid testing centers. They would be go on duty in these rapid testing centers in Luneta. And then they would be the much feared transport nurses. And to top it all, they had to go back to the health centers too, so that disruption of the public health programs would be prevented. Okay, so the human resources started to go to be depleted, and it was thinly spread. Some health centers and lying-in clinics had to be closed. So there was double burden responsibility shifting from one task to another. To actually, it was triple responsibility. Okay, and then the next challenge would be the nursing skills. So emergency nursing, they had to dig deeper into these skills. One nurse during her first day in the hospital was asked to assist in intubation. Even the simple even the simple task of IV insertion, charting, and medications, computing for medications. These were simple tasks, but for public health nurses, assisting intubation was a different thing. Another one, communication skills. So communication skills in extracting information for the CIF forms, the case investigation forms, communication skills in counseling patients that were COVID positive. One nurse had to deliver an imminent delivery at home, which she hasn't experienced all these years of her nursing life. Some did postmortem care, and then we had to learn the new lingo of PPEs, doubling time, etc. And then we have to learn technology, the new technology, which was computer-based, paperless technology. uh, the logistics, of course, there was the need for laptops, cell phones, and the much needed Wi-Fi connections. Webinars and Zoom meetings were parang nauso. And then the donning and doffing of the PPEs. And then they had to learn infection control. With these nursing skills and with this task, there was unparalleled risk, and nurses were getting sick, contracting the virus. Okay, these were shifts because they had to shift from one area to another, and because of this, it had its psychological and physical implications. They would cope with COVID, being COVID, and then being COVID free, and then go back to work again. Okay, so some nurses did not have the call to accept the challenge. So it resulted in resignations and early retirements. And then the last would be the public health programs. Public health programs they were disrupted, and um, it had to take a back seat to give way to this COVID pandemic. Immunization, prenatal, postpartum, resulting in imminent deliveries and unwanted pregnancies. So um, people would not go out, but when people were asked to go out, they feared contracting the virus. Okay, family planning, you had to deliver the commodities in hard to access areas. The NTP program, what they did would be treatment completed and not cure rate anymore. Okay, so the fear is that with all the efforts, with all the initiatives that we have undertaken to increase coverages in all these public health programs, would slow down because of this pandemic. And there's the fear of emergence and reemergence of diseases that would have been eliminated or reduced. So there is again this fear of an outbreak, kabilat kanan. Okay, so how did we cope with these challenges? Okay, so these are the best practices na kahit papano nakaraos kami. Okay. So the first one was the strategies to control transmission among its staff. It it is easier said than done, but the minimum requirements for uh, transmission of infection is so hard to implement, especially if you are in a health center or in a quarantine area. Okay. Next would be, this was an incentive for us because with the resignation of nurses, there was a hiring of new public health nurses and promotion of nurses sometime in August, July or August of this year. I remember new nurses taking the exams. One of the one of the questions in the essay type question was are you willing to be assigned in a quarantine facility? What do you think are your skills or your abilities that you can share with the department in to face this pandemic? These were the kind of questions that we asked during the hiring of new nurses. And then we have a Manila Health Department Nurses Association and local associations per district, which foster unity and solidarity. Um, they give support to each other. We give fund assistance to nurses who contracted the virus, and there is this bayanihan spirit, what they call ayuda. They would go to the market or to the grocery to buy commodities so that they can send it to nurses who are confined in the hospitals and in quarantine facilities, or even at home. Dinadala nila yon, nagmomotor sila. Okay? And then one of the nurses said that it's so painful to see a colleague, a co-nurse, uh, inside the tent or it's so painful to take care of a colleague who is also a nurse at that she is confined in the hospital or in a quarantine facility. So with this, yung unity and solidarity, nagkaroon kami ng creation of chat groups and which open communication lines. Chat groups, I remember one district in Tondo, which was its nurses were badly afflicted with the COVID because they are in Tondo. They created a chat group for nurses who were found positive for COVID, and uh, this seemingly reduced the stress. They find comfort and strength from each other through communication, so that it eases the pain and the loneliness and the ambivalence that they feel. They have this seemingly parang sharing of universality of feelings, parang ganon. Okay? And with this, of course, the resiliency and commitment. Let us take note that these nurses, pre-pandemic, they chose not to leave the country. They chose to stay here in the Philippines to serve the community. With their strength, their resourcefulness, and willingness to serve as frontliners in the community, they have the capacity to adapt and transform themselves in a way that they would meet these challenges. Little by little now, we see the nurses smiling again. We see them parang ano na sila, anong tawag doon? Medyo relax na sila ngayon. And then going to a quarantine facility is not a big task anymore. And some nurses would have wanted to stay in the hospitals and do their tour of duty in the hospitals. But then we have to recall them here because of the human resource depletion. Okay. So the last but not the least is the renewed faith in your family, in your colleagues, and most of all, the renewed faith in God. Every day, the nurses would wake up, thank God that they are not sick, and ask God not that their families and they themselves will be protected from this virus. Okay, so preparedness. If you were to ask me preparedness, no. The preparedness was nil. Sometime middle of last year, the mid-level technical chiefs went on planning workshop outside Manila. And this planning workshop, we were made to differentiate a hazard from a risk from a pandemic. Little did we know. The planning workshop entailed mitigation plans and everything. But with the suddenness of this pandemic, all these plans parang they were not put into practice. So now we have to face the new normal. Okay? And then we are concerned with health workers' safety. Maybe we could find ways to not only the physical well-being of health workers, but also the psychological well-being of nurses. And one nurse said that we can conduct trainings on therapeutic communication skills. Okay, and then we suggest that in the nursing curriculum, basic epidemiology and surveillance and disaster preparedness would be included in the curriculum. Okay. Here are some pictures that would show the experiences of the nurses. We don't do consultations in the health centers anymore. We look for places outside of the health center. Like this one, this is a basketball court. Daily, they would bring out these props. They would bring out all the logistics, vaccines, pantimbang, medicines, drugs, and everything, and then set up the health clinic in the basketball court or anything na nasa labas. Okay? So this is the daily grind consultations. The consultations average from 50 to 100 now. Before it was limited to 20, but now people start going out. So ito yung consultation in a basketball court. This is the new normal. Oh, this is immunization, vaccination using the PPE. Child monitoring, weight monitoring of children, and then ito yung pinakaano ng nurse, health education and information outside sa labas ng health center. Okay? Oh, this is bringing family planning commodities. A nurse supervisor, the the program coordinator, bringing family planning commodities to to the community, to the barangay. This is Senior Citizens Day with the flu and pneumonia vaccine in a basketball court again. This is contact tracing with and without a PPE. You could just imagine navigating the alleys of depressed areas wearing a PPE. Think about it. You have to wear the PPE for 4 hours and then go back to the health center to do recording and reporting. Okay? This is the surveillance nurse. Buong araw nag-e-encode siya ng na contact na trace na contacts. Okay? And then this is a nurse in a quarantine facility. So nakakangiti na sila. And then this is the much feared transport nurse. So they go to Tala, they bring patients to Ultra, Philinvest, Alabang, etc. So eto, OFW dinadala sa kung saan man yung quarantine facility ng OFWs. This is the painful part, extricating the patient from his family, from the community at any time during day and night. Okay? And this is counseling inside an ambulance. Imagine mo the patient is so agitated because she is being brought to a quarantine facility and you are doing counseling to that patient. Okay? This is a funny side. This originally he was a transport nurse, pero tanggal kagad siya. He was removed from the transport list because no PPE would fit him. He is quite tall. So ang ginawa niya, siya na lang ang taga-deliver ng ayuda sa mga nurses. Okay? And one funny thing, there was this nurse so that she could go to the quarantine facility to report. She would use her motorbike without a license. So hindi naman siya nahuhuli. Okay. So these are the encoders. These are all nurses in the Manila Emergency Operations Center. They are data managers, they are encoders. Okay, these are all nurses. Okay, so these are surveillance nurses having their daily meeting with the action officer for COVID pandemic, Dr. Santos. Okay, these are the surveillance nurses. Oh, ay, Yorme namin. Ayan, kasama siya sa planning. Nagre-report yung mga nurses. These are our nurses. These are nurses. They are the data managers. This is our action officer and this is our city health officer. Okay. And this is of course yung pogi namin mayor. Okay? Next. This one. Ito yung ayuda. This is the ayuda that I'm telling you about. They would go to the market, go to the grocery. They have a revolving fund and they would be sending this ayuda to those found positive na nasa quarantine facility. And then, these are parang thank you notes via the webinar, thanking the people in the quarantine facility, the barangay, the patients, thanking them for services rendered to them during their stay in the quarantine facility. Okay? So this is a nurse. Ito yung presidente ng asosasyon namin. He's a young nurse. So twice siyang na-admit sa hospital. He was a transport nurse for so many months. So he was admitted to the COVID hospital twice. So he transmitted the disease to his wife, who is also a public health nurse, his 2 kids, and the 2 yayas. So he is still in quarantine right now, and he is bringing his children to the province already. Okay? So, wala pa yung maraming salamat. In closing, when we face the new normal, after all this, we can all look back and say, bakit merong maingay? I was a frontline health worker. I was a frontline public health nurse during the time of pandemic. Let us all learn from this. Thank you for the opportunity. Thank you to all the frontline public health nurses and most especially to all the Manila Health Department nurses. Thank you very much and maraming salamat po.
Okay. Maraming salamat. Thank you. Hello. Thank you, Ma'am Rafael, for the talk. And Prof. Ria, I think ang isa nating nakikita dito sa sa discussion ni Ma'am Rafael, it's we usually think of yung crisis on a negative I mean, it's really something that is mahirap, negative, but
Mhm.
the way it was presented, Prof. Ria, di ba, ang isang lumalabas amidst the crisis, there emerged the good and right attitude among us,
Yes,
no?
ma'am. Yes,
Tama
ma'am.
ba? Isa dito yung nasasabi ni Ma'am na unity and solidarity, and one of which also is resilience. So I think ito yung pwede nating tingnan lighter side or the positive side also of this situation, no? Okay, for our next speaker, uh, she finished her bachelor in nursing degree in year 2000 at the West Visayas State University, La Paz, Iloilo City, and got her diploma in teaching at Iloilo State College of Fisheries in 2002. She completed a 9-year clinical instructor career at the WBSU College of Nursing. She is currently employed as nurse 2 at the local government unit of San Enrique, Iloilo, assigned in the Municipal Health Office. In 2017, she was tasked to accomplish some special assignment as a member of the core planning team and at the same time part of the technical working group of the two major plans of the municipality of San Enrique. Our speaker is also a member of the National League of Philippine Government Nurses Incorporated and a member of the contact tracing group of COVID-19 pandemic of the municipality of San Enrique, Iloilo. As one of the frontliners in this time of pandemic, fighting against the spread of COVID-19 is a little bit risky and hazardous, but she has been fighting, still fighting, and is determined to fight COVID-19 until the end. Let us all welcome Ms. Lisel Marie Omena.
Hello, good afternoon everyone. Maayong hapon sa mga Ilonggos na nakikinig sa ngayon. So I am Mrs. Lizelle Marie Porras Omena, the Public Health Nurse of San Enrique, Iloilo. We are the town belonging to the 3rd class municipality and belonging also to the 4th Congressional District in the province of Iloilo. I am proud, Ilongga. Okay? So before I begin my slides, I would like to share with you, okay, for a while. Okay, this is it. Okay, so it is my pleasure, everyone, to share with you our experiences during this pandemic. Nako, ang dami din namin na-experience na mga nurses. Hindi lang ako, syempre yung makasama ng mga nurses. So, how did we respond to all this, okay, crisis? And what are our responses to these challenges? Actually, this pandemic has changed our lives. Ang dami-daming nagbago sa buhay namin. Okay? It has a long-term implications, no? And yet unclear to all of us. Walang makakaalam hanggang kailan ito. Nobody knows. Okay? Only God knows. Okay, so everyone is at risk, especially as frontliners. Hindi lang kami na frontliners, yung mga kasamahan ko dito, but also our family. Okay? In my part, I have also my daughter and my senior citizens na mga nanay at tatay na kasama sa bahay. So they're also part of those those at risk. Okay. And I do believe that nurses, all nurses in the world will agree with me when I say that nurses can't beat this alone. Hindi lang po kami na nurses. Okay? We have to collaborate, we need to negotiate, and we have to work hand in hand with other sectors. And also for the rest of the health personnel. May doctor din tayong kailangan. May mga midwives din tayong dapat tumulong sa atin. Hindi lang tayo. Hindi natin kaya to. Okay, malaking problema kasi to. Okay, with my slides, I divided my slides or presentation into 6 parts. Okay? We have there the contact tracing, okay, infection prevention and control, laboratory and therapeutic access, then clinical care, risk communication and community management, and the last part is the logistic support. Okay, first po, contact tracing. Siguro maraming nakakaalam na nito. Ito kasi yung malimit na maririnig natin, okay? For the contact tracing, everybody knows. It is the process of identifying, assessing, and managing people who have been exposed to a disease to prevent onward transmission. Ito yung definition ng contact tracing. So what we are doing in our community, in our own community, we have a contact tracing team. Given na yun, kailangan meron tayo niyan. Okay? So anong ginagawa nito? Anong ginagawa namin sa contact tracing team? So the team then begin contact tracing by warning those who are exposed, okay, individuals of their potential exposure as rapidly and sensitively as possible. Rapidly. Dapat mabilisan, hindi pwede bukas na. Okay? Kasi yung bukas mo, many lives will be at risk. Okay? Contacts are also encouraged to stay at home. Okay? Strict 14 days home quarantine. Okay, sa amin yan. Yun yung protocol namin. Okay, for those who are ill, kailangan sabihin mo sa kanila, you must be honest to tell us. Okay, if you feel any signs and symptoms for those who are in quarantine. Kasi malimit ang problema namin, many are not telling the truth. Pag sinabi mo, okay, ikaw kasama doon sa na-contact trace, may dinadaramdam ka ba or any signs and symptoms na naramdaman mo, sasabihin nila, no, we don't feel anything. Kasi yung stigma attached, okay? Di ba sa COVID-19 na pag nalalaman na nakakontak ka na doon sa positive, baka sabihin kami din may COVID din. So yun ang problema natin. So kailangan i-emphasize sa kanila the importance of not telling, or the importance of telling us the truth kung mayroon silang dinaramdam. So we have also the BHERTS. Yung mga BHERTS namin, yung barangay health emergency response team namin, they're the one responsible to make sure that those people who in quarantine nga na 14 days, dapat naka-strict home quarantine talaga. Kasi malimit kasi, pag hindi natin isasabi to or inform yung mga barangay health officials natin, baka akala lang natin nandun sila sa bahay pero nandun na pala sa market, namimili na. Okay? Because they thought, wala lang, naka-contact trace lang sila, hindi nilam yung extent o yung risk, ang level ng risk na kung baka pag lumabas sila, marami din ang maapektuhan. Okay, importante lang, we have to inform them the possibility, pag may dinaramdam, yun, sasabihin ka agad, at pagkatapos, maging honest lang all the time pag may nararamdaman. Okay. Ito yung mga kasamahan ko, no? Makulay kami. Okay? Kung inyong makikita, no? Teletubbies kasi yung gusto namin mangyari. Amidst all the hardships, amidst all the risk, the fear, pinapasaya namin, no? We motivate ourselves kahit sa kulay na lang ng aming PPEs. Okay? Ito yung mga 5, actually, there are 5 of us in our contact tracing team. 5 lang kami dito sa RHO. May mga kasamahan din kami sa ibang opisina, pero most of the time hindi sila sumasama kasi medyo, the stigma nga, the attached to the COVID, and yung risk at yung takot, baka, magkaroon din sila ng COVID-19. So kaming taga-health, we don't feel any, kami, yung term namin doon is, mga robots siguro tayo. Okay, indispensable. Hindi tayo pwede mana ng COVID kasi hindi tayo natatakot. Okay? So yun na lang. Okay na lang yun. Okay na kaming 5. Okay. Our next slide is all about infection and prevention and control. Okay? So dito, loob dito yung routine disinfection. Not only our quarantine facility, but also for the rest of the areas in our municipality or town, like yung mga market, okay, yung municipal hall namin, at yung RHU. Every end of the weekend talaga, yung routine na yon, pinapa-disinfect namin yung mga areas na yon. Okay, as much as possible, we encourage during the weekend, wala munang pupunta ng market. Okay, kung hindi naman kailangan. Tapos, yung every time na may lumalabas, okay, sa aming facility, automatic yon, i-disinfect agad yung room at yung mga lugar na pinupunta ng lumalabas. Mayroon kaming disinfection team din. If may contact tracing team, mayroon din disinfection team. Parang isang tawag lang. Okay? Ito yung mga kasamahan ko sa health center. Okay? Ito yung ibang kasamahan ko rin sa quarantine facility. So, significant concerns have been raised, no? Whether they still have to access treatment, and others are anxious also whether they are when they are sick, and the elderly will have to continue the healthcare in relation to non-COVID treatment. So in the midst of the emerging response, the health team cannot afford to ignore the people's broader needs like immunizations, maternal and child care, and treatment of chronic illness and other diseases. Hindi pwedeng nang dahil lang may COVID-19, hindi na tayo mag-immunize. Hindi na tayo pwedeng mag-prenatal. Pwede ba natin yun mahinto yung pagbubuntis? Eh hindi nga. Di po ba? Mas marami nga ang nabuntis ngayon dahil nga sa, di ba, nag-ECQ tayo, mas marami naka-prenatal ngayon. Okay? And in doing so, pag in-stop natin yon, that will cause deadly ripple effect, leaving our clients more vulnerable to preventable illness and disease. Di po ba? Mas madami ang mamamatay, mas marami yung maging problema na natin. So kailangan tuloy-tuloy pa rin yung mga health services natin amidst the COVID-19. Okay. Pero kailangan, I always make sure that I always remind my children, patawag ko kasi sa mga kasamahan ko dito kasi mga children, my children, kasi I'm used to, inside a classroom, I'm calling my students, so the same. Mga kasamahan ko dito, you have to make sure, you have to wear your PPE lang. Okay? Despite all the health services, wear your PPE para maging safe din tayong lahat. Okay, for the laboratory and therapeutic access. Okay, you have the collection of oropharyngeal and nasopharyngeal swab samples or RT-PCR testing. Libre lang to sa amin din. Thank you, Lord, kasi kahit paano, maka-RT-PCR test pa din yung mga tao dito sa amin. Okay, so yung RT-PCR test kaso lang, ngayon, hindi na siya, ano tawag doon? Regular na ginagawa, automatic pala, pag LSI ka or OFW, pag dumating ka sa place namin, automatic na iswab, hindi na. Sa ngayon, yung ginagawa na lang namin, pag symptomatic na, that's the time we will swab. Kasi ang mahal din naman kasi ng RT-PCR test. We don't have that much, money or budget na all the time na lang bibili kami ng RT-PCR tests. Okay. Okay. Ito yung aming unique individual tested. So we have, as of September 18, we have 349. Okay? Medyo hindi siya ganun kadami kasi nga kinikontrol din namin. So out of the 349, majority from LSIs natin. Ang dami kasing LSI namin. Okay? Yun ang isa sa mga challenge na naranasan namin sa ngayon. Yung issues and concerns namin kasi sa LSI ay yung quarantine facility namin is overwhelmed by the uncontrolled arrivals of our LSIs. Yung pasulpot-sulpot na lang parang mga kubote. Yung parang hindi, may darating. Parang ganun. Walang informal lang na darating sila. So, another one is uncoordinated travels. Yun nga sabi ko, hindi sila nag-inform. May 13 sa isang araw na dumating, may 20. So, ang liit nito naman ng capacity ng quarantine facility namin, only 30 rooms lang. So, sa isang araw, dadatan ka ba naman ng 10? 20 na lang yung may remaining. May OFWs pa tayo, may mga close contacts pa tayo, di po ba? Then also, mas pinipili nila yung sa Katiklan. I know for sure you're familiar with Katiklan because of Boracay. Di po ba? The distance of Katiklan from San Enrique is about 4 to 5 hours. So doon sila dumadaan kasi mas mura yung pamasahe doon. Yun ang problema namin. Siyempre, maintenance-wise, okay, sa gasolina ng ambulance namin. At tapos naman, hindi lang isang beses lang sa isang araw, we have to fetch our LSIs there. But sometimes we have to fetch 3 times a day. So 6 hours yun. From here or 4 hours from San Enrique. Imagine niyo lang, 8 hours travel. Then babalik ka na naman to fetch another 1 LSI or 2 LSIs. Okay? And then the second one, kung makikita nyo, after the LSI, we have the close contacts. Automatic kasi. All close contacts namin is swab talaga yan. Regardless symptomatic or asymptomatic, we have to swab. Okay? Then the third one, we have the frontliners. Sa frontliners na belong yung RHO personnel, yung BFP natin, at saka yung sa mga police, yung PNP natin. Okay, and the rest. Kung tatanungin ninyo ako kung what these others refer to, yung mga pregnant namin. Di po ba? Most of the hospital already required swab testing or result of RT-PCR test for our pregnant, yung mga anak. So automatic na, o the 36 or 37 weeks na mga anak, pinapaswab na namin para wala na silang problema anytime na mga anak sila sa hospital. Yun po. Then we have here, okay, our positive COVID-19 cases. As of September 18, we have 30, okay, positive cases po. And 26 out of the 30 po, we have 26 who recovered. We have 3 deaths and 1 active case po sa ngayon. Okay, yung 3 deaths namin, yung dalawa in the hospital, happened in the hospital, and the other one, yung naka-home quarantine namin. Yung naka-home quarantine namin kasi, senior citizen din, 80 years old na siya. Okay? So, nandun na yung risk talaga sa kanya. Hindi na naman namin siya madala sa hospital. Takot na din yung family na dalhin siya sa hospital dahil nga sa edad. Tapos, kakamatay lang din ng isa nilang kasamahan sa bahay. So kung dadalhin doon, hindi pa nga nakuha yung abo ng isa nilang kasamahan sa bahay, baka nga naman, another na naman, abo na naman pag umuwi. At nangyayari nga, namatay yung isa nilang kasamahan sa bahay, another family member, another case of COVID-19 sa isang family lang. 2 namatay, 4 yung naging positive. Out of the 18 na nakontak ng positive na yon. Okay? So, we do hope hindi na mangyayari ulit yun. Kasi yun ang para sa akin, may laking impact talaga sa akin as a health worker. Kasi hindi maging madali na mamatayan ng 2 sa isang bahay because of COVID-19. Hindi pa nga nakuha yung isa, hindi pa nagawa yung death certificate ng isa, nandun na naman yung after a week, namatay naman yung isa. Okay? So, another one, clinical care. Ito yung ginano namin, yung parang SOP namin dito. Yung LSI namin, ROF, or Returning Overseas Workers namin, yung upward namin, pag asymptomatic, hindi na namin napa-RT-PCR tests. Okay? Automatic lang din kasi kailangan facility quarantine sila for 14 days. Then observe for any signs and symptoms na lang po for those who are asymptomatic. But for those who are symptomatic, LSIs, ROFs, and upward, kailangan i-RT-PCR test din sila. Okay, then of course, another one, 14 days quarantine pa din sila. Pero kung yung symptoms nila no longer belong to the mild symptoms, kailangan nilang ipa-hospital, then kailangan din namin silang idalhin sa hospital. Okay? Then for those who are home quarantine, nasama doon yung mga frontliners natin who have undergone RT-PCR tests. Yung PNP, BFP, RH personnel, automatic yon, pina-home quarantine namin. Dahil ano na lang din naman yun screening lang din naman. Hindi naman siya positive dahil positive sila. Then our all newly discharged patients from hospitals and their folks, automatic din yun, home quarantine for 14 days. Okay? And also for our close contacts of a confirmed 19 positive case namin, automatic din yun. RT-PCR test, sabi ko nga kanina, kung pag symptomatic po sila, then facility quarantine. Pag asymptomatic, home quarantine lang sila. Kasi hindi nga ganun kadami yung facility namin para lahat sila ilagay namin sa facility for quarantine. Okay. Ito yung risk communication and community engagement namin. Yung tinatawag natin na recorrida. Ito yung sound system, nilalagay siya sa isang truck para, to travel along sa lugar namin para i-remind yung mga tao regarding the importance of health protocols like kahit simple social distancing, yung mga wearing of mask, kasi ang dami pa rin matigas ang ulo. Okay, hindi natin yun mawawala, yung mga matitigas ang ulo. Lalabas ng bahay, kakausapin yung makasamahan doon sa mga neighbors. So we do the recorrida at times para ma-remind sila. Then of course, if many of our if the people go to our RHU for health services, automatic yun. We also do our health education or yung IEC namin. Automatic na lang yun kasi it's our time, it's our chance to inform them or remind them about corona virus. Okay, of course, we have our informative flyers as well na pinamimigay sa mga barangays. Okay, ito yung last slides actually. Kunti lang yung slides ko kasi ayoko din na madami kasi importante yung pinaka-focus lang sa amin dito. As you can see, yung makasamahan ko yan, they are nurses, they are midwives, and they are responsible for quarantine facility. Kasi nga, di ba, sabi ko kanina, ang daming ayaw pumunta ng quarantine facility kahit mag-ask kami ng help no, from our job orders here in our municipality. Sana ba naman kahit na magbuhat lang ng mga folding beds, magbibigay ng pagkain sa mga rooms, ayaw. Kasi nga takot nga sa COVID-19. No, yung stigma nga attached doon. So kami na lang lahat-lahat kukuha ng pag may dumating na 40 gallons of water, sama-sama na lang aming bubuhatin lahat yun papunta sa aming nurse station. Pag may folding beds na darating din na 30 folding beds, yun dadalhin din namin. Kami din yung magbubuhat nun. Okay? Yung mga food packs, automatic kasi yung food packs eh. Pag may dumating, automatic food packs and hygiene kits, pinamimigay. Binibigyan talaga lahat-lahat. Okay, any time of the day, kahit sa gabi pa siya dumating, may food pack siya at saka may hygiene kit. Kasi nga din natin alam, baka gutom na yun pagdating nila. Diba may dumadating na 12 in the midnight, mayroong 2 a.m., 4 a.m., syempre hindi na sila nasama doon sa budget ng dinner. So sabi namin, kahit naman lang cup noodles, may maibigay na yung aming municipality. Di po ba? Kahit kunti lang yun, malaking tulong na yun sa mga dumadating sa amin. Lalo pa ngayon because our OFWs are no longer, they don't have already free accommodation from OWA. Yun ang pinakamasakit. Kasi nga, naubos na siguro yung, baka naubos na yung budget ng OWA. Kaya lahat na lang ng OFW, sa municipal area na siya. Okay? Lahat isusunduin na namin sa airport. So, part din sila nang bibigyan ng mga food packs at lahat ng kailangan din nila. Okay, mga hygiene kits din nila. Okay? So, yung PPE provided by our LGU yan. And also very lucky because ang dami ding nagbibigay sa amin na, mga donations from other places. Like yung sa akin, personally, I'm very thankful kasi yung makasamahan ko sa West Visayas State University College of Nursing, they also give us some PPEs. Okay, kasi siguro naawa din sila sa town namin. Baka malaking tulong kasi kahit na 10, mapadalawa man yun, malaking tulong na mabigyan po kami. Okay, so before I end my presentation, please allow me to share my realization, overall realization na lang po siguro amidst this pandemic. So, health workers and local government officials are facing many challenges right now. We understand that difficult decisions and compromises will need to be made to protect people's lives. There should be a balance between public safety and economic interest. This idea will help on to get through the major challenges it faces and allow us to emerge stronger and more united San Enriqueans. None of us know how long will it take to overcome the challenges of COVID-19, but I do take comfort in seeing and knowing how my colleagues in public service, our local leaders, and other organizations have responded so quickly to accept and adapt to these very challenging new conditions. I strongly believe that if we really love our work, we will be out there every day trying to do our best despite of and in spite of all the risk and danger. Good afternoon, everyone. Maayong hapon. Salamat po.
Thank you very much, Ma'am Lizelle.
Yes.
That's very well said. Collaborate, negotiate. Those are the main 2 words that highlighted your presentation. And, I love your enthusiasm and energy in sharing us these stories. It makes it,
ma'am.
You're welcome, ma'am. It makes it seem that it's not that difficult. Pero, di ba, I admire how you are able to handle existing cases on top of COVID-19 issues. And
Yes, ma'am.
yes, ma'am.
Kailangan lang.
Totoo
Fight
po.
lang.
Yes, ma'am. Bite lang. And for those who, us who are playing chess, we call the pawns as our frontliners. But then after hearing your sharing, I realized that the community nurses are actually those pawns that we make use to, make our first move. Kayo po talaga yung nandun, yung nakasalang.
Yes, ma'am. Kami
Ma'am.
po yung, yung palaging tinatapon na lang kahit saan. Pero
Mm,
ready naman kami to fight. Okay,
yes, ma'am.
kailangan
Thank
ready
you.
lang po. Always ready lang po. Yun po.
Yes, ma'am. Salamat for that. And without further ado, let me introduce another key player
Thank
in
you.
the community nursing field. Our next speaker is a public health nurse from the City Health Office of Cagayan de Oro and is currently serving in two health centers. These are barangays in Dahag and Taguanao, along with medical officers, midwives, barangay health workers, and barangay nutrition scholars. The speakers team are part of the Barangay Health Emergency Response Team for COVID-19, which represents the health sector. The team, together with the Barangay Council representatives, are coordinating with other agencies as part of the COVID-19 task force. Our speaker also serves as mental health nurse coordinator for the City Health Office of Cagayan de Oro. She, is, she has undergone International Mental Health Training Center in Taiwan. A graduate of Bachelor of Science in Nursing at Xavier University, Ateneo de Cagayan, she has been serving as a public health nurse for over 6 years, implementing programs under the Department of Health. Please welcome Miss Meg Leslie Yu.
Hello, everyone. Good afternoon to all of you watching. I am Meg Leslie Yu, a nurse from the City Health Office of Cagayan de Oro. So you know our city as a city of golden friendship. And today, I will be sharing to you my experiences, our strategies, and even some challenges that we have encountered here in public health as we're dealing with this pandemic. So what we're going to do now is maybe uh, do a storytelling through pictures of what we're doing in our city. Okay, sorry for that technical difficulty. So, at the onset of COVID-19 in the Philippines, the City Health Office spearheaded the reactivation of the Barangay Health Emergency Response Team, or otherwise known as the BHERT. So, this was mandated by the DILG because our country's approach to fighting this pandemic is going down to the grassroots level. It was our responsibility as nurses, along with our medical officers, to inform our respective barangay councils. So this included orienting them about the roles and responsibilities of each BHERT member. And it also included informing them about COVID-19 and its implications in our context. It's expected that since you belong to the health sector, your council would look to you for information and concerns relating to health, mainly because the RHUs and the health centers are the community's nearest access to health care. So at the time, there were no local cases yet and travel wasn't restricted. So we had to monitor people with travel history in countries affected by COVID-19. In the beginning, if you could remember, they were tagged as PUMs and those with symptoms as PUIs. We also did intensified health education in the communities and in the schools. We placed information, education, and communication or IEC materials in strategic areas. Because after all, prevention is still at the heart of public health. So this went on for a while until eventually the country had its first local case in March. By then, we had to adjust our algorithms. So adjustments were made on the protocols established. Every day, our city mayor, Mayor Oscar S. Moreno, along with our acting city health officer, Dr. Lorraine Honconeri, and our city epidemiologist, Dr. Tudolfo Joselito Rituya, along with other representatives of pertinent agencies in our COVID-19 task force, would conduct a press conference to update the people of our city about our current situation by presenting data and the initiatives and measures done by the local government. As of now, the LGU has mandated an ordinance mandating the use of face masks with penalties for violations, as well as the ongoing curfew implementation and the adaptation of minimum health standards in all public places and transportation. One initiative instituted by the City Health Office is what we call the acute respiratory infection or ARI or influenza-like illnesses ILI monitoring, wherein our BHWs, our BNS, our CDVs would conduct daily house-to-house visits to monitor ARI cases. So they would report these cases to their respective nurses, who in turn monitor, respond, and treat these reported ARI cases until they are resolved. The nurses then collate these data and report it every day to our operations center. This is done to identify if there is a clustering of cases in a barangay, and this would alert us to a possible local transmission. By March 11, we had our first case in Mindanao. A local resident from Lanao del Sur who was admitted in a hospital in Ligan, but was later referred to Northern Mindanao Medical Center here in Cagayan de Oro. However, it was not until May 7 when we had our first local case here in the city. By then, a lot of protocols were already established. Travel is strictly monitored. And part of our responsibility as nurses in public health is to be aware of all of these, as we are part of the implementing body. So today, all individuals that arrived in our city are tagged as NAIs or new arrival individuals, and they are classified as LSIs or locally stranded individuals, non-LSI, ROFs or returning overseas Filipinos, and APORs or authorized persons outside of residences, and they are subjected to a mandatory 14-day quarantine. So the LGU of our city has utilized 31 hotels, inns, and dormitories as facilities for quarantine, which we call City Isolation Units or CIUs. As of today, we have 26 active CIUs, and 5 of which are temporary treatment and monitoring facilities or TTMF, where some of our COVID positive clients are admitted. Since the beginning, our city has never closed its doors to people and individuals coming home, traveling for work or humanitarian reasons. But if they arrive by plane or ship, they will be met by nurses or other personnel deployed in our airports and seaports, and will then be ushered or admitted for facility quarantine. And eventually they will be swabbed, or some cases are endorsed to their BHERT, the respective BHERT, for home quarantine. As for those who travel by land, the BHERT in the barangay monitor their arrival, or they coordinate with their families to make sure the client passes the home quarantine checklist, which you can see in their screen. This is needed prior to the arrival in order to qualify for a home quarantine. Sometimes we encounter situations wherein the client's house does not meet the qualification set for home quarantine because, like for example, we need a separate room. So in my area, there are a lot of relocation areas, and a lot of these individuals are living with their extended family with shared rooms. So it makes it difficult for us to implement our strict home quarantine. So that poses a problem. As you can see, we also have here endorsements of persons traveling for humanitarian reasons and endorsements of APORs. So what we do is, what our office did in coordination with the barangay LGUs was to establish barangay isolation units in each barangay. So we could accommodate those individuals that do not qualify for home quarantine. However, this would also depend on the availability of a space or a building that would pass the qualifications for ABIU. Well, it is to be noted, however, that our city has also been trying to limit non-essential travels outside of CDO by instituting measures like the issuing of barangay certificate done by the barangay in coordination with the health center personnel, medical certificate from the city health office, and a travel authority from the PNP. Once these individuals admitted in the CIUs are swabbed with negative results, they are then discharged and endorsed to their respective BHERTs to continue quarantine at home. So this is done in order to decongest our CIUs and to make room or to accommodate more new arrivals. So the nurses in the CIUs would coordinate with us, the nurses in the field or in the community, to endorse the clients for discharge. The challenge here is the influx of people that would arrive in our city. And at times, a lot of the times, our CIUs would be accommodating at full capacity. So this results to more individuals being endorsed to their BHERTs for strict home quarantine rather than the recommended facility quarantine. For instance, last September 16, a total of 1,191 individuals were accommodated in our CIUs. This included 547 LSIs, 318 returning overseas Filipinos, 55 authorized persons outside of residences, and 271 close contacts of confirmed COVID-19 cases. So what the previous speaker, Ma'am Omena, said was true. A lot of people, would you believe it or not, arrive in our city daily. So these numbers that I presented to you still do not include the people who are doing quarantines at home, who arrive by the city by land travel, or are close contacts of confirmed COVID-19 cases that are assessed to be low risk, and those individuals who are quarantined in our containment areas or containment zones. So what are these containment areas or zones that we have? These containment areas or zones are established after careful assessment of the surrounding area or nearby residences where a confirmed COVID-19 positive case resides. So basically, a temporary lockdown is done to the surrounding area assessed to be at risk of exposure. This is done in order to contain the spread of the virus. So these individuals in the containment zone are monitored for 14 days. These individuals are monitored every day, and should they develop symptoms, will be reported to our operations center for extraction and admission in the CIU, and they will eventually be tested. So these are our colleagues manning our operations center. And these four of our colleagues are also part of our Health Emergency Management Services, or the HEMS. Whenever a containment area is established, the nurse, along with the members of the BHERT and the barangay council and representatives from other agencies here in the city, like the CSWD, the PNP, CHO, assess and plan for the containment area. So you can see in our slides examples of containment areas. In my experience, when we had our first local case in my assigned barangay, this resulted to a containment area with 47 households affected and 185 individuals placed in quarantine. As you can see, a few days later, we had another local case in a gated community. This resulted to 11 affected households and 42 individuals placed in quarantine. So we had 2 ongoing containment areas. And as a nurse, it's your responsibility to oversee the monitoring of all of these individuals quarantined, to respond to their concerns and to coordinate accordingly. The challenge usually is the different concerns that arise in a temporary lockdown of an area, such as food, water, work arrangements, maintenance medications, and of course, sometimes there would also be people who would complain or get angry and be uncooperative. So sometimes because of the increasing number of containment areas in other parts of the city, we would lack support from the PNP because having simultaneous containment zones would mean a divided workforce. So every day, at any given time, we would be catering, monitoring, and endorsing clients that have arrived in our area, are endorsed by the CIUs, or are those quarantined in our containment areas. So all of these individuals are under home quarantine. These data are reported daily, along with our RE monitoring, in addition to all the other programs and activities done in the health center. In cases of emergencies where individuals need referral and immediate medical attention, medics from 911 usually endorse these cases to the BHERT for initial assessment. So the health center personnel often serve as first responders in these cases. In addition to this, the increasing number of COVID-19 cases in our country have caused some people to avoid going to healthcare institutions and hospitals, and this has somehow resulted to home deaths. We as public health workers also attend to these cases. Oftentimes, these aforementioned incidences would entail making initial assessments that would put us in direct contact with patients. And not all facilities are actually equipped with PPEs. So at times, we would have to make sure that we observe standard safety measures like distancing, using a face shield and face mask, and if available, isolation gowns. So I have here a comparative data of our cases from the month of August 14 and September 15. As you can see, most of our cases in August came from LSIs and ROF. But as you can see, on September 15, there's a sudden rise in the number of our local cases. From 34, there was a sudden increase. And this is our reality today. And as we look at the trend, it may still increase in the days to come. And if we remember in our community nursing, ideally one nurse is in charge of a 10,000 population barangay. But in reality, some nurses handle more than one barangay, with populations ranging from over 10,000 to 30,000. At times, it would be difficult to single-handedly monitor every individual in your area, which is why it is very crucial to be able to work together with your medical officers, midwives, BHWs, BNS, and CDBs in the monitoring of the people quarantined in your barangay. This, along with your sitio or purok leaders, SKs, and barangay tanods, all of whom are part of our BHERT. As a nurse, it is your responsibility to be able to coordinate with all of them, together with other different agencies and authorities involved. Because really, part of the reason public health can serve in the capacity it is able to today, reaching even the most remote communities, is because of the unwavering, selfless, and dedicated efforts and service of our BHWs, our BNS, our CDBs, TANODs, and all other barangay volunteers. So this, with the cooperation of our barangay councils, our city leaders, homeowners associations, youth leaders, SKs, and other members of the community, allows us to effectively serve and protect our barangay and the city as a whole. Because one of our key roles in public health is to engage and encourage community mobilization. In fact, just recently, our city conducted a simultaneous citywide information drive. So this was done to increase awareness, and this was done by the different barangay information officers in our city. In public health, caring for the community is approached in a holistic manner. When you serve people in the community because you are immersed in the environment, more often than not, you are involved in the lives of the people. So caring for them usually involves attending to their concerns, not just limited to health, such as the food, allocation of supplies, coordinating transportation, and planning accordingly. And while all of these preparations and protocols in COVID-19 are being done, our routine programs have not ceased. So just like what our previous speaker said, we just can't stop our routine programs because of COVID. We continue our existing programs and provide services such as um, such as immunization for our infants, HPV vaccines to 9 to 14-year-olds, pneumo 23 and flu vaccines to our elderly. We have vitamin A supplementation and deworming, prenatal for our pregnant mothers and teenage mothers as well. MCP deliveries, we have newborn screening treatments, and then we have treatments for our NCP patients. And then we also have consultations via our doctor's telehealth initiative. And we also give maintenance medications to our non-communicable disease clients. Just last July, we also continued with our Sabayang Patak contra polio. So we were doing house-to-house immunizations to 0 to 59 months old children. In our setting, some of our nurses also handle special programs, such as the newborn screening program, family planning, adolescents. We also have senior citizens, dangerous drugs, smoking cessation, cancer, and in my case, mental health. So which means that amidst our preparations and responsibilities in our respective health centers and as members of the BHERT, we also work towards improving and continuing our special programs in the midst of the pandemic. So just last September, we celebrated the World Suicide Prevention Day, and we spearheaded a webinar on suicide and depression. This was entitled Beyond the Silence, a talk on understanding depression, which, as we all know, is very relevant in these times. So each of us had to come up with ways in which we can continue providing services while protecting ourselves by adjusting our work environment. So we had to adapt in this new normal, since healthcare is one of the services that will not stop amidst the pandemic, but will all the more be needed. So you have to actually learn to work with what you have. You have to be resourceful and take initiative in preparing your facility despite the lack of budget. So some of our personnel actually creatively designed hand washing areas outside of their facilities. They also made shields out of acetates, or they also had glass shields installed for consultations. They placed foot baths outside of their health centers. Others moved their immunization or prenatal to areas or courts with larger space to maintain social distancing. These are all initiatives thought of by our healthcare personnel. Of course, sometimes we cannot also help but be concerned for ourselves, our families, and even the community we serve as we continue to do our house visits. But because, there's always a risk of exposure for all of us. And as you can see, as of September 21 in our city, a total of 233 patients were currently taken care of and monitored in our city's temporary treatment and monitoring facility. This includes 22 non-CDO residents. 64 were scheduled for swabbing and re-swabbing. We had 10 new recoveries, which brings it a total of 348 recovered patients. 41 new cases, 4 LSI, and again, 37 local cases, bringing it to a total of 582 cumulative cases, including all recoveries. As I mentioned earlier, if you look at the trend, this may still increase in the days to come, which would also mean an increase in our current workload. Managing all of these responsibilities while finding ways to adapt our programs to this new normal, given limitations in resources like the budget, time, and manpower, poses very real problems or challenges that often do not have ready solutions. Since public health immerses the personnel in the lives of the people within the community on a very personal level, the service we offer often entails sacrifice, often going beyond reasonable expectations, but it is always driven by compassion and a sense of purpose. So I hope that somehow gives you all a glimpse of the work and life in public health. Thank you so much for listening.
Okay, thank you so much, Miss Meg. Thank you so much, Miss Meg. So,
Yes,
Ria,
thank you.
yes, I think, Prof. Ria, we heard also from Miss Meg yung mga best practices ngayon, no? Best practices, which I think similar din at common din sa ibang mga speaker natin na maganda at na-share din sa atin. Ang isa din nakikita natin, hindi na set aside, Miss Meg, yung mga regular or services, hindi natin nakalimutan. Andyan pa rin yung sabi mo adolescent program for, I mean, and also immunization, which I think even at this point in time na may crisis tayo, it's still very important to look into also the other diseases, di ba? Hindi, marami pa rin may sakit sa hypertension. So I think
Yes,
nakita ko
that's
doon sa
true.
presentation mo, Miss Meg, na meron tayong mga preparation or additional preparation for this crisis that we are facing right now, pero hindi natin nakalimutan at
Yes.
pinagpapatuloy din natin. So, narinig din natin, Ma'am Ria, kanina, no? Sinasabi niya, new normal, you have to embrace. I think embracing the new normal doesn't mean so alone na i-set aside natin yung mga regular services natin. Meron kayong pinapakita din telehealth, nakita ko
Yes.
yung kanina, meron pang siguro yung mga health education program, no? But it's somewhat kinostomize nyo na ngayon. So,
Yes.
yun, Miss Meg, ang aking nakita at na ano sa iyong.
That's a nice term to say.
Yes,
Nakaka-customize.
yes. Kaya nga nakikinig ako, sabi ko, oh, good thing, andun pa din yung andun pa rin, Ria, no? Andun pa rin yung talagang the typical, yung talagang magsisilbihan pa rin natin yung ibang population, no? Right? So yun ang isa sa magandang nakita din natin. Anyway, this time, siguro we can now start the open forum. So, open forum na po, no? So, tingnan natin kung may mga questions tayo dito si Prof. Ria, baka gusto mong simulan ang unang tanong? Okay, ang unang tanong natin para sa ating mga speakers.
Okay, we have several questions in line, but it's nice to while waiting po and while finalizing the line of our questions here, let me just share with you how I love the speakers sharing their community experience, making us really identify all the in different aspects of life, ma'am. Na
Mm-mm.
parang hindi lang kasi usually we are very much aware of the needs in the hospital setting, and now
Mga
ito
tanong.
na po yung ating sitwasyon sa labas ng hospital naman po. Now we have a question here that says, how do you monitor the health status of your frontliners? How often do you perform swab tests to them? Think we can start with Ma'am Nelia.
Opo, yung tanong nila paano na monitor kasi base sa mga discussion kanina, Prof. Ria, no, yung risk din, yung interaction, yung danger din, no, na
Yes,
pwede
ma'am.
tayong mahawa. Pero siguro we also have to consider also our frontliner. So ito po siguro yung tanong, ma'am.
Yes. Mm-hmm.
Okay, swab tests are very, very expensive, if you know. Okay, so because of the number of health workers in our department, it is not done on a regular basis as what you think. Those who have, let's say, in our office, for example, or in a health center, those found having symptoms, they are immediately swabbed, okay? And then after swabbing, quarantine ka until such time that the results come in. And if it's negative, okay lang. And then sometimes we close down a facility, parang Christmas tree. When one turns out positive, or two of them positive, so contact tracing talaga yan kung saan nakuha. But if the health center or the health facility or a lying-in clinic ang health workers na nagte-test, kunyari tatlo, apat nag-positive, they have to close down the whole facility. And everybody has to undergo swab testing. But it is not done on a regular basis. those who have symptoms, doon ka magi-start.
Mhm.
I don't know with the others.
Siguro pwede po din natin tanungin si Miss Meg.
Actually, it's basically the same with Mom Nelia. So the swab test is not routinely done to health workers. This would actually depend on your situation or the assessment of the risk. So, for example, you are a health worker and you are manifesting symptoms, then they would observe, and then eventually, if you qualify for, if you are assessed as, high risk, you would be swabbed. If you are close contacts of a confirmed COVID-19 case, you would also be extracted, admitted in the CIUs, and if you have symptoms, you will be placed in our temporary treatment and monitoring facilities where you will be scheduled for swabbing. But not all health workers who are exposed are actually swabbed. So that actually depends the on the risk assessment. Because as Ma'am Nelia said, the test is very expensive, and every day there are so many people who are also needing the test. So that's basically what happens in our city.
Thank you for that. Ma'am Lizelle, please.
Same din sa amin, no? We don't do it in a regular basis. Depende din as necessary nga, PRN. Okay? Nurses nga, PRN. As needed na lang siya. Pero sa awa ng Diyos, no? Sa awa ng Diyos, kakatapos lang namin lahat ng RSU personnel, lahat kami team tests. There are 30 of us, 35 of us, na-test kami lahat. Then after that, we don't know when will be the next. Pero sana naman wala. Kasi lahat naman kami so far, wala pa naman nag-manifest ng symptoms sa amin. So I think that's it.
Po.
Thank you, Ma'am.
So it's
That's
really
siguro.
symptom-based.
Okay. Ma'am, Prof. Ria, may isang tanong dito kasi for sure may mga nanonood din ibang outside nursing. If a family was quarantined because one member was positive and the family tested negative, should they still be quarantined for all 14 days? Ito po yung tanong.
Mm-hmm.
If a family was quarantined because one member was positive and the family tested negative, isang member lang, and the rest negative, should they still be quarantined for all 14 days?
Yes po. Sa amin po, yes. 14 days pa din. Kahit na tested negative, kailangan ubusin mo pa rin yung 14 days. Kasi nasa protocol kasi yun eh. We have to make sure, kahit home quarantine lang siya, basta 14 days naka-quarantine siya. Oo. To make sure, kasi nagpe-play safe kami always. Okay? Kasi ang dami rin namin na cases na pwede na later on, nagmamanifest, on the last day, nagmamanifest pa ng symptoms. Kahit kasi na-experience namin yan sa facility namin, on the 14th day, nag-show na siya ng symptoms. On the first 13 days, wala. So akala namin tuloy-tuloy na, pero on the 4th day, talaga nag-manifest ng symptoms. So same, kailangan talaga maging safe tayo always. So nandun tayo sa 14 days pa rin.
Thank you, Ma'am. Thank you, Ma'am Lizelle. Ria, ito pala, may isang tanong dito, Ma'am Ria, yung tanong, how are nurses compensated when they contact the virus? Meron po bang additional siguro support, finances? Ay, support na lang. Mahirap yun.
So siguro si Ma'am Nelia.
Yeah. DOH, I think DOH has a policy. If you are hospitalized with severe symptoms, parang 100,000, but if moderate symptoms, documented dapat ito. It should be documented, 10,000 K. And then during the earlier part of the COVID days, there was an incentive to all frontliners who went on duty from March 16, I think, to June, June or May. May compensation na 500 pesos a day sa lahat ng ipinasok mong araw, but may mga guidelines kasi ang city budget namin for that. there are guidelines on that. So, hindi lahat talaga nakukuha. That's why the association, our nurses association, thought of something. Maliit lang naman yung funds namin sa association. So, they are compensated like 1,000 for for each nurse who contracted the virus, be it in nasa hospital siya, facility quarantine area, or home quarantine, 1,000 flat for all the nurses who had this virus. And then, aside from that na, yung ayuda na sinasabi ko, na sometimes they send in cash or in kind para sa mga co-nurses nila. It's a small amount, but parang it's our way of showing our concern, our gratitude for the nurses who got the virus.
Yes. Thank you very much, Ma'am Nelia. Another question here. Are there any issues encountered concerning the PPE supplies for public health workers? So remember, ma'am, nung una nating na-experience ang pandemic, yun talaga yung...
Naubusan.
Yes.
Naubusan. At ito yung problema. Ngayon siguro, Prof. Ria, nakamute ka. So siguro ito pa rin yung tanong, meron pa po ba tayong shortage o tayo po may supply na po ng PPE?
Kasi yung remember ma'am, nung unang nagkaroon ng mga campaign ng mga drives for donation, ang bagsak po talaga ng donation is sa hospitals, that we would like the world, the universe rather, would like to see the...
So ngayon siguro Ma'am Sel, Ma'am Del, yes, and Ma'am Meg, ito po ba ay isa pa nating concern o ito po ba ay na-resolve na po siya o patuloy pa rin siyang ating pinag-iisipan at yung problema po?
Regarding the PPEs?
Yes, the PPEs.
No, we don't have problems regarding PPEs anymore. Dati meron, oo. Wala na ngayon.
Kami din, we don't have any problem about PPEs. Medyo lucky kami doon sa portion na yun. Okay? Well provided po.
Okay, thank you po dun sa...
How about you, Miss Meg?
Meg, nga.
In our case, actually in the beginning, yeah, that's true. A lot of PPEs were donated in the hospitals, but eventually they gave some to the office. But majority of the PPEs are actually given in our operations center as they are doing the extraction and admissions of our suspect clients, right? So there is maybe a shortage of PPEs given in each barangay health center, because as you know, we have 80 barangays here in the city and 54 health centers. That is a lot of workforce. You have roughly 20 BHWs or BNS in each facility, and it would be difficult to provide every single one of these facilities. So sometimes the barangay LGUs who would be able to shoulder some of these need for PPE supplies. But if I would say that there is a PPE supply in all of these centers, not really, not that much, but there is in our office in the operation centers. But we're given isolation gowns and some other forms of PPE.
Okay. Thank you very much, ma'am.
Thank you.
Professor Rita?
Baka medyo gusto mo mag-hello dyan. May mga nagko-comment bago natin pagpatuloy yung question. Meron bang, I think may mga nag-hello at nagko-congratulate sa ating mga speaker. And I think probably we can read some, Prof. Ria.
Okay, ma'am. Sure.
Isang dalawa. Para naman may space din sa atin.
Yes, ma'am. For a comment from Miss Melissa. Thank you po sa lahat. Thank you sa lahat ng ating mga frontliners. Mabuhay po kayo. Another would be from Jennifer Reyes. Thank you very much for your hard work and perseverance.
Para naman may tayo. No? So siguro ito, may iba question pa po. Kung sinong gustong unang sumagot ay, have you adopted an official algorithm as risk assessment for health workers? Ito yung tanong. Kung meron na po tayong adopted official algorithm, yun ang sinasabi yung Ma'am Ria, official algorithm as risk assessment for health workers. Okay. Ma'am Lisel?
Kami sa health center dito sa amin, we don't have an official algorithm as long as yun nga, yung always na sinasabi lang pag may dinaramdam, any symptoms na nararamdaman ng any of us here sa health center, sa mga personnel dito, maging honest lang. Yun lang. Kasi mahirap na maghawaan eh. Mahirap din na ma-lockdown yung RHO. Malaking issue yun. Malaking problema yun.
Malaki
Okay.
ang kawawalan ng ano, I mean,
Mawala ng services. Okay. Yes po.
Yes, ma'am.
so,
Totoo
Ma'am
po.
Ma'am Nel?
Yeah, of course, we have an algorithm. I'm not so familiar with the algorithm because I am not involved with the operations, but Manila is such a big city. We have more than 12,000 cases now. Kaya talagang may algorithm kung sino yung actually we don't encourage home quarantine anymore, but given the socioeconomic status of those in the depressed areas, we cannot afford to be placing people in home quarantine. So what we do is extricate the patient and bring them to a quarantine facility. As of now, we have I think 11 quarantine facilities. Two are being closed for disinfection. The schools are serving as quarantine facilities. So there are COVID facilities. There are talagang minor and parang doon sila. Positive talaga sila sa COVID with symptoms. So these are COVID facilities. And there are isolation, konti na lang ang isolation facilities namin kasi lahat halos positive for COVID. And we have a COVID hospital, which is Santa Ana Hospital. It's a 10-story building. Puro COVID lang doon. And then the rest of the hospitals, the 5 other Manila hospitals, city hospitals, merong specialization like for one hospital, this is just for yung mga admissions ng pregnant women who would be delivering. And then we also have quarantine facilities for postpartum women found positive for COVID. Parang i-isolate mo yung nanay sa baby.
Siguro, Ma'am Nel, follow-up question lang po. Kung may isang tanong din po, kasi kung sila po ay nagtatrabaho sa facilities, uuwi daw po ba sila araw-araw or do they need to stay in the facility?
That's one of the problem because sometimes the nurse has her tour of duty today in the quarantine facility. Now they don't want to go home. It's not their schedule to report to the health center, but they would rather report to the health center for fear na dala nila yung virus sa bahay nila. So hindi siya naka-schedule for the health center activity and yet they go to the health center and then they get their off duties. So, these are manpower concerns. These are human resource concerns that we're trying to fix this. Every quarantine facility has its own, how do you say it, management styles. Like there are nurses na quarantine nurses lang talaga sila, but sometimes there are shifts like because they have to go back to the health center to do the monthly, weekly, monthly, quarterly report. And with now DOH is asking us to implement the new reporting system, kaya they have to go back to the health facility talaga. Ang nangyayari na lang, ma'am, is they quarantine themselves at home. Hindi sila nakikipag-usap sa mga anak nila, sa asawa nila.
Yes, ma'am. So ngayon parang pa lang the work in progress, no? We are still, kumbaga, pinag-uusapan pa, ma'am, kasi minsan madaling sabihin na magkaroon ng facilities for them. Pero syempre, ang issue pa rin dito ay budget. Ang issue din dito siguro psychosocial or whatever. So these are the things that we can also consider. But I think ito po din ang isang tinitingnan kasi, di ba, Prof. Ria, malaking bagay din pag ikaw ay nagtatrabaho talaga sa isang facility na katulad ng sinabi ni Ma'am Nel, it's a 10 floors na specifically devoted lang for COVID patients. Just imagine if you're working also working po tayo dun sa lugar na to, Tapos uuwi din tayo sa bahay. So these are the things siguro na I think na pag-uusapan naman po, no? May mga preventive measures just like what Ma'am Nelia said na pwede siya Ma'am Lizel na no, ano na lang, kayo parang kayo po, hiwalay na lang kayo sa family o ibang rooms. So I think these are the ano. Ma'am Ria, meron pa tayong mga questions like ano pa? I
Yes,
think
ma'am.
meron
Sorry.
po.
Yes,
Sige
ma'am.
po.
Sorry po. How about the situation in Visayas and Mindanao po, ma'am? Ma'am Lizelle, yung
Oh, kasi
setup po
in Manila,
siguro.
yeah.
Kasi we have heard about the setup in Manila. How about po sa Visayas and sa Mindanao po? Uwian din po ba ang ating mga nurses?
Okay, sa amin, umuwi kami ng bahay namin. We don't have any choice to uwi kami kasi wala naman kaming quarantine facility for, for personnel. Pwede gamitin namin yung second floor namin, pero syempre may mga pamilya din kami na kailangan din kami. So to make sure lang maging safe din sila, pag umuwi kami, kailangan naliligo ka talaga. Maligo ka talaga diretso. Yung usual na pag umuwi ka diretso ka ng banyo, kahit anong pagod mo, kahit anong, after all okay lang maligo ka lang talaga. At tapos, a few minutes pa bago ka maki-join sa kanila. Okay. Pero ikaw din naman, self-isolate ka. Pag sa palagay mo, you are feeling something. Like may mga sign, like may medyo kumakate yung lalamunan. Okay. May sipon, hindi natin may iwasan yun kahit hindi naman yung COVID. Pero katapano, mayroon na. Okay, di po ba? So, kailangan self-isolate lang. Kailangan maging lang siya. Maging ka lang. Alerto. Always. Yan no.
Miss Meg?
It's basically the same, we still go home to our respective houses because, like, for example, if you're deployed in the ports or in the seaport, in the airports, we only do certain shifts. So they still go home to their families. But as a health worker, you would have the initiative to assess yourself, or if some workers also do self-isolation. So they opt to really separate from their family in a separate room while they're still serving in these facilities. And if you feel like you are having symptoms, it would already be understandable that you would isolate yourself, or you would report to the office so you can subject yourself to a facility quarantine.
Okay, for Brian.
Thank you very much, Ma'am Meg. Another follow-up question for you, since this is a mental health issue. Is there any mental health programs provided to our frontliners in a public health setting?
Well, the mental health programs in our city is available to everyone. There's not really a specific program intended just for our frontliners. So we actually have Kamusta Ka. There's also initiatives done by the City Social Welfare Division, or the Psychosocial Division of the CSWD, that you can call. You can talk to psychologists and experts. You can also be referred to a telepsychiatry here in our JRB, or the city hospital, also in our Northern Mindanao medical centers. There are avenues for you to reach out. There are also actually some non-government organizations that provide mental health programs, such as like a church, a group, religious organization. So you can actually avail these services whether you are a frontliner or not, because mental health is it is something that we should all have, right? And it's not just going to affect the frontliners, but also these people who are isolated in their homes.
Yes, that's true. I agree. Thank you very much, ma'am. How about Ma'am Lizelle?
Actually, well, not sa mental health, medyo hindi kami masyado pa nagpo-focus sa ngayon. Pero if you say something, if you refer to the frontliners about mental health, lahat naman tayo nag-aral din ng health, mental health. So kailangan na lang, everybody should play their own role, encourage na yourself. If you think you're depressed, then you have to, do something, to combat that stress or depression. Kasi nga, di ba, sa panahon ngayon, sa trabaho natin, kung isipin lang natin lahat ng hirap, maging ma-depress tayo. Kung isipin na lang lahat yung risk, wala na magtatrabaho. Po ba? tayo na lang ang naiiwan. So kailangan talaga huwag tayong magpapatalo sa lahat ng mental stress na mayroon tayo. Not only mental stress, but also physical stress. So kailangan talaga, you motivate yourself every day, kaya natin to. Yun lang. Maging positive thinking lang talaga.
Okay, may ano ba? Siguro pati yung ano din work environment among us, I mean sa atin sa unit, 'di ba, Ma'am Giselle?
Yes, ma'am.
Yes. Kailangan din hindi lang siguro yung sarili natin, but we also make sure na
Motivate yung mga kasamahan.
narinig ko kay Ma'am Nelson kanina na makikita mo kahit sa crisis nag-emerge yung mga good attitude. So,
Yes.
yun things, 'di ba? Yun yung magagandang bagay talaga na nakita natin na pag in crisis, akala natin, yes, there is indeed na meron talagang negative. Pero based sa mga nadinig natin kanina, Prof. Ian, no? Narinig ko may nag-emerge yung magagandang attitude. Tumitibay tayo, tama, Ma'am Michelle. Resilient, commitment. Yan yung mga naririnig ko kay Ma'am kanina, kay Ma'am Nel, habang nakikinig tayo na lumalabas yung bayanihan ba? Lumalabas siguro dito yung tulungan, which I, yun, yung mga bagay-bagay na yun, no? So, ang isa pa, dahil nga napag-uusapan natin ang public health nursing, di ba? I mean, nakita natin na at this point in time, tayong frontliner, tayo yung talagang in touch sa atin sa community. Tama, Prof. Rian, no? May nagtanong dito, ano daw, siguro siguro kung ito ay estudyante, isang tanong niya, o kaya isang nurse, newly grad, ano daw ang sabi dito, Ma'am Ria, ano daw ma-advise, no? Ano daw pwede niyong i-advise? Tama ba, Ma'am Ria? For nurses wants to pursue public health nursing. Oo, ano bang meron? Ano bang dapat meron sa kanila, no? Prof. Ria, ano kayang dapat meron sa mga nag-aspire? Kasi baka it takes a lot, or it takes what? It takes a heart, di ba? Mga ganon. So, talaga naman, it takes a heart. Totoo naman, di ba, Ma'am? I mean,
Totoo. Yes, ma'am.
yes, definitely. Okay, so Ma'am Nel, I think yung mga nag-aspire po maging public health nurse expert, yun tanong ano daw ang kailangan? Anong advice ninyo, Ma'am?
Oo.
First of all, siguro kailangan wala kang sites to go abroad. Wala kang sites because the entry level in the city of Manila is nurse 3. It's grade 16. It's not so much, but it's okay na yung grade 16 with 13, 14 months salary plus Magna Carta for public health workers. That's and then clothing allowance, hazard pay, etc. Compared to sa abroad, hindi talaga ganun kalaki. But in public health, you are really willing to do field work because doing field work is such, sabi ko nga sa'yo, the nightmare of a public health worker is an outbreak. When you do door-to-door immunization, that's the most challenging of all. You know, when you do defaulter tracking, sa init ng araw, with all the diverse problems like going to the small alleys, sa outskirts ng community, you are prepared for that. Sabi nga, umiitim ang mga nurses sa public health.
Kailangan may payo.
The tasks are varied. The tasks are varied. You know, when you work in the hospital, after the charting, you're done. You go home. But in public health, you have to contend with a lot of functions and roles. Kailangan kaibigan mo ang barangay. Kailangan marunong ka ng community organization. May leadership ability ka. Leadership in terms of kahit maliit yung center mo, you're able to lead the barangay workers, the midwives, and the nurses under your care. You're able to, you should be able to teach, you know, the transfer of knowledge from the physician, kaya mo mag-lecture sa community, kaya mo magturo sa barangay worker. It's the ability to teach and to share your knowledge, the knowledge that you have learned. Siguro yon. And the adaptability to various situations. I think sila Meg and Lisel would agree. The is doing field work.
Yes, Ma'am. Okay. Ma'am Lisel.
If you can still, yes, diba? If you can still remember on the end part of my presentation, sabi ko kanina, just love your work. Because if you love your work, you can do everything. Di po ba? Diyan nagsisimula pag mahal mong isang bagay, Di po ba kahit sa isang tao, pag mahal mo, lahat gagawin mo. Ganon din sa trabaho natin. If you love your work, walang problema yun. Lahat, kahit anong kahirap, gagawin mo lahat. Yun, ang ano lang, talaga lang, love lang talaga. Love
Talagang
your work.
passion siya, Ma'am Lizelle, no?
Yes,
When
hindi siya, calling din siya eh. Para sa akin yung
Mhm.
PHN, dapat calling din siya. Hindi siya ordinaryo na kailangan maging PHN lang ako. Kailangan i-ready mo yung self mo. Pag nasa community ka na, 24/7 yung trabaho mo. Hindi lang 8 to 5 p.m. Just like, di ba yung shifting sa hospital, 7 to 3. Pag 3 p.m., tapos ka na. Pero sa community, may mga anak pa ng 12 midnight. Oh, puntahan mo pa yun. Di po ba, ma'am? Always ready ka talaga pag ka sa community. And ang isa pa dapat na i-install mo dito is yung trust and confidence ng tao sa paligid mo. Importante yun.
Totoo po.
Dapat kasi mamahalin ka ng tao pag may trust and confidence sila sa iyo. Yun lang po.
May sincerity ka rin, ma'am. Talaga sincere ka to your work. Kaya nga sabi ni Ma'am Lizelle, you can't just work, but it should always be with a heart. With a heart.
Yes, with a
So
heart.
kahit saan naman siguro, not only dito, I think kahit
patient.
saan naman trabaho, kailangan may puso, di ba? Para kahit anong hirap,
Kakayanin mo.
kakayanin lang. Oo. Ma'am Rian, medyo siguro na-inspire na mukhang marami magpa-public health nurse, no? Given
Yes,
sana.
Oo, sana. Mas maraming pupunta po, no? Marami. Okay. Ito nga lang, siguro nga, although nasagot na, pero siguro I'm just curious, how frontliners, siguro sa context po natin, manage the stress they are facing every day. O nga naman, Prof. Rian, no, every day, pupunta sila sa isang facility. Ano, no?
Yes, ma'am. And they have a different kind of stress kasi ma'am, for example, yung kanina na kunento nila, they have to be very, very resourceful, and they also have to learn initiative because these nurses are actually in charge of technical, not only that, but emotional first aids. Sila po
So, ibig
yung
sabihin,
unang haharap kapag galit ang pasyente, kapag galit ang tatay ng may, di ba? Bakit kayo late? Sir, 8 hours po ang biyahe. Mga ganun
at
yung
the end of the day,
pinag-iingat.
drained pa rin tayo, ma'am. So, siguro
Yes,
gusto lang
ma'am.
po nila based experience natin. Paano nga ba
Yes,
kayo
Ma'am
nag-manage ng
Leslie.
stress
Yes,
nyo?
Ma'am Meg.
Ma'am Meg muna, si Ma'am Meg.
So actually, it really depends on the person. But I do agree. Sometimes when you're handling so many things and we have so many things in our plate, the stress does take a toll on us. But I think one of the key things is to find ways to cope with stress. So you can have so many distractions, and amidst all your busy schedules, you should still find time for yourself. Whether it be reading a book or eating your favorite food, or making use of the workplace as something as a fun place as well. For example, even though I go to duty every single day to do different areas, I really enjoy coming to work when I get to see my PHWs and DNS, and we discuss so many things not related to work. In times when we have a little free time, and these are one of the things that I can de-stress. And somehow when you go to work and you enjoy the people that you're working with, so it really takes the stress out of things. So even if we're doing containment facilities, we're locking down areas, and we find something that can be amusing, we just use that, and we make light of the situation that is sometimes otherwise heavy. But sometimes it does become very difficult. Everything you said is true. Sometimes we get scolded at by families, and if you really put it to heart and if you take it to home, sometimes it would really affect you. So part of it is really changing your perspective, and also responding in ways that is also not just beneficial to them but also to you. I think that's it.
Yes, Ma'am Nel.
Yeah, parang you treat your health facility, your health center as your second home and your second family. These are varied kasi ang disciplines, the physician, the dentist, the midwife, the nurse, the barangay workers, you treat them as your own family, your second home, your second family. And when you have a second family in the workplace, that releases all the tension, and like Um, Now we are going to celebrate the Nurses Week this coming October. So our nursing service will be celebrating again 50 plus years na. And the nurses look forward to celebrating every anniversary, the yearly anniversary. They always look forward. Magsusuot yan ng costume, ng mga magkakaroon ng beauty pageant. But with this pandemic, wala yan ngayon. But this Nurses Association, it's sort of um, parang nagfo-foster ng solidarity, and you are solid and you are united, you are happy.
Yes. Maganda yun, Ma'am Nel. Dapat yung work daw natin is our second family. So, pag tinignan nating family yun, Ma'am, di ba? Kahit anong stress yan, I mean, kaya lang. No? So, that's a good, ano po, magandang napulot nating pieces of advice also from na Ma'am Nel. Ma'am Lisel, meron kang self-care kasi kay Ma'am Meg eh. So,
I always don't think my work. I don't think my work as work, but I think of my work as service to the people who needs me, and then on the rest of the health personnel. Kailangan isipin natin palagi, hindi trabaho, dapat isipin natin makakatulong tayo. Seeing the joys, no, yung contentment sa mga patients natin every day, isa ring bagay na makakawala ng stress natin. Kung other patients are causing us stress, think of other patients to give us joys. No? Parang yung we came to serve and not to be served, di po ba? So kailangan lang talaga talagang maging enjoy lang yung service natin sa tao. Yun lang, importante doon. Don't think it as a work. Kasi pag work ang isipin natin, maging yan hirap.
That's true. Opo, ma'am. I think it's really the passion to help and be of service that's making our community nurses continue despite all of the unsaid sentiments. I mean, we all have our own, unverbalized issues. But then, if you really have that passion burning na hindi ka nanunumbat, it doesn't, you're not that really concerned about the money that you are getting. It's
Yes.
actually yung the simple thank you na yung nasabi
the
ng
joy.
mga tao that they appreciate you and that you were able to reach remote communities that other people cannot, be of service to. Ito yung mga nag-ignite sa atin na gumalaw na mas maging malalim yung pagsaserve natin sa mga kapwa natin. This is what's making the community nurses so special. Na parang ang galing na tuloy-tuloy lang po kayong nagsaserve with the smiles on your faces, and then we have to highlight the fact that not everyone believes that community nurses are really frontliners. It's a sad fact. And then I am thankful for this avenue because we are highlighting your experiences and making them realize how important you are.
And I think, Prof. Ria, kahit ang ating topic is public health nursing, it applies across different areas eh. The basic, the core natin ng mga natutunan. So, siguro at this point in time, Prof. Ria, we can also have siguro a sort of medyo natin, ano bang mga mula sa simula, paano natin, ano ba yung mga napag-usapan natin ngayon. So, I think yung unang napakita natin ng ating mga speakers is yung mga best practices. Though halos na best practices pare-parehas naman po, no? And I think hindi lang din tiningnan sa practices, tiningnan din po yung psychosocial. Yun po siguro, Ma'am Nel, Ma'am Diesel, and Ma'am Meg ang hindi mawawala sa atin sa nursing. We will definitely look into the physical aspect, but more importantly, tinitingnan po natin yung psychosocial. Kasi nga, ito yung profession with the heart, no? I mean, kailangan daw may puso. Tapos, hindi lang tinitingnan din dito yung pangangalaga sa mga pasyente, pero pangangalaga din sa kapwa nating co-workers, no? Kaya nga, ganda yung kay Ma'am Nel, yung pag-treat mo talaga yung work mo as your second home, and your work is really like a home, di ba? Iba yun no? So siguro sa ganitong in time of crisis, Ma'am Ria, siguro malaking bagay din siguro yung workplace natin ay maging home, no? Very homey.
Yes,
so, hanggat maaari siguro, it can be a haven of peace, a haven of understanding, right? Ayun. So, marami tayong nakuhang hugot dito sa ating mga discussion. Kasi hindi matatawaran din yung hindi matatawaran po kasi Ma'am Nel, Ma'am Lisel, and Ma'am Meg yung yung sacrifices natin, yung risk, every time na pupunta ka sa facility, magbabahay-bahay kayo, di ba? Sabi nga ni Ma'am Nel, mainit or whatever. And despite of that, the good thing also across is, tama Ma'am Ria, na tuloy-tuloy pa rin yung serbisyo natin sa ibang sa ibang mga aspeto ng pangangalaga sa kalusugan. Hindi lang po tayo nakatutok sa COVID, no? So siguro pwede tayo mga last Ma'am Ria, siguro pwede natin tanungin sila mga last parting words or any, hindi naman closing. Parang, lang, tawag dito, konting statement lang po para sa ating mga nanonood. Kasi ngayon bang viewers na to, Ma'am Ria, o tanungin natin, ilan na po? Kasi makikita natin kung ilan na ang ating mga live audience or viewers po ngayon. Meron na po ba? So, siguro mamaya titingnan namin at Pero anyway, while waiting po, pwede siguro mga lang po, words for our for the family, for the community, and also for our colleagues. Ma'am Nel, siguro inayin si Ma'am Nel. Naka-mute po kayo, Ma'am Nel.
As I've said before, thank you for the opportunity that UP has given us for us public health workers for being heard. And I would like to thank all the public health nurses all over the Philippines and all over the world. At saka most especially Manila Health Department nurses for not leaving the department, for staying with us in this time of pandemic.
Ma'am Lizelle, thank you very much, Ma'am Nel.
Ako, I'm very thankful, UPOU, for inviting me as your speaker, webinar speaker for this afternoon. It is really my pleasure to be your speaker and given this opportunity. And I would like also to say thank you also to my coworkers. I salute them also for sharing their time for pandemic. Also to the rest of the PHNs all over the world, not only in the Philippines. Thank you so much for being there, always, for always there, ready to fight, ready to serve, and to serve with a heart. Sabi nga ni Ma'am Ram.
With a heart, no? Dapat parati may
with a heart. Yan ang importante. May puso dapat. Yes. Thank you so much. Good afternoon. Maayong hapon sa tanan.
Thank you, Ma'am Meg.
So I'd just like to thank you again for this opportunity, for this avenue, for allowing us to be able to share the life of the people in public health, not just nurses, but everyone involved. Thank you, because hearing other people's stories would also encourage us to just trudge on, right? And I think one of the things that we just need to remember is we will be able to fight this if we fight it together. And together we would rise if we just work together and just continue what we're doing. And I think it really takes passion and love to do this calling. Thank you again for this opportunity. And to all the nurses out there, continue doing the job, continue doing a great job.
I agree. Thank you very much, Ma'am. And I also agree that this COVID is really a different experience and we have different strategies. And thank you for sharing that with us to control everything. That the problem in engaging and encouraging community mobilization is really, a problem. But with your help, it's becoming possible. And your service and protection to our barangay as a whole. But it's really remarkable.
And okay.
Sige,
Okay,
sorry.
Masyado lang kami full of ni Ria.
Yeah,
Masyado kami marami na
2 hours, Ma'am.
Parang walang dull moment sa kailangan, di ba, Ma'am Ria? Kaya siguro full of ngayon ang discussion natin compassion, emotion, lahat ata, no? Damang-dama. I mean, kung kayo po ay nandito sa aming lugar ni Prof. Ria, damang-dama namin yung compassion, passion, lahat among ito po sa aming mga invited speakers, no?
Yes,
Kaya
ma'am.
sa pagkakataong ito din, Prof. Ria, we would like to thank our speakers for sharing their experiences and knowledge with us. We would also like to thank everyone who watched and participated in our program. Meron na ba tayong updates, Prof. Ria? Sige, habang hinahanap ni Ma'am Ria, again, we hope that you have learned a lot from our speakers. Of course, wag po natin kakalimutan ng ating MC team for the technical assistance. And also for the MAN program for making this webinar possible. Meron na po ba tayong updates para naman wala pa po. Sige.
Oh, wala
Kung
pa
wala pang
naman.
update, sige Ma'am Ria, baka may sasabihin ka pa.
Yeah,
May
well,
mga
ma'am, I'd like to
reminders
thank
lang.
the speakers because they contributed really great ideas, that could address different kinds of nursing issues. And then even Ma'am Nelia suggested something that can help the academe. This is really the root cause. I mean, if we have to address something, dun tayo mag-start sa habang nag-aaral pa po ng nursing ang mga tao. I would like to highlight that. And I am talking about what are the things that the students should really prepare while they're still young. Yun po yung na-highlight natin. So, do we have the stats now, ma'am?
Okay, habang
Hello?
hintay, sige ma'am, para naman bago tayo mag-close, magsabi naman kami kailan ng ilang stats. So, kasi
Yeah.
ito po ay live po tayo at marami din tayong audience. Pero yun nga, habang hinintay natin, yun nga po, marami tayong hugot, no? Marami tayong mga learning experiences from this discussion. Anyway,
Yeah.
nasabi na ba natin yung mga sa certificates, no, ma'am?
Not yet. For the webinar certificates, please copy the link or the
Okay,
and
maraming salamat po. Daghang salamat at
Mhm.
ingat po sa lahat. Bye-bye po.
Let's all be safe,
Thank you.
everyone.